The title of our project is the On the Ground Clinical Lymphedema Education Programme. The programme came from a pilot project and we wanted to go out and take education directly to community nurses. One of the outputs from the OGIG programme, what we won the NHS Wales Award for, was a wet leg pathway. This wet leg pathway has been adapted and used throughout the UK. So we actually know that it's been embedded into pathways in community services in England and also in Scotland. It's been put into a chapter in German in a book. So we know that we're reaching and improving the pathways for patients internationally.
PROSTAD was a multi-party collaboration between Hywel University Health Board, Tritech Institute, Swansea University, with key sponsorship by Cancer Research UK through the Test, Evaluate and Transition programme.
Since winning the NHS Wales Award for efficient care, we've seen various pieces of work undertaken. First and foremost, we published our evaluated research that provided all of the evidence to support the case for change within Hywel. That fed into a business case with the clinical and operational teams. That business case has been approved. And we will now be moving the PROSTAD pathway into routine clinical service delivery. I
found that it's been very empowering and motivating to the project team members and to colleagues that work alongside us. And finally, it's been really quite humbling to receive thanks and positive feedback from patients and patient groups that have benefited from the project.
The project for which myself and my team won the NHS Wales Award was for expanding non-cancer supportive care over a period of 18 months in order to address palliative care referral barriers. Since winning the NHS Wales Award, we've continued to consistently demonstrate patient experience measures. We've taken this value-based data as an opportunity to underpin a new strategic plan in Cardiff and Vale. And this seeks to overhaul the whole of palliative, supportive and end-of-life care for patients regardless of diagnosis, cancer or non-cancer. We will be looking to share our data with other health boards to help support them in creating business cases, and hopefully that they can also secure funding to look at further improvements in end-of-life care in other areas of Wales.
I think we should all look at changes. We should all look at improving what we're doing. Nothing should stay the same. If you see something that you think can be changed, collect what the problem is first, get the baseline, and then make sure and take advice on the data that you're going to collect as part of that project. Collecting the patient outcomes is so important, because why are we doing what we're doing? We're doing it to improve the patient's journey.
Bringing around change is possible. I think you need to believe in that and have the dedication. I think it's important that you have the right team around you.
Collaboration is fundamental. We all work in a very demand-focused health environment at the moment, and sometimes we don't have the space, the headspace to lift ourselves above routine care and then look at the opportunities around any innovations.
To understand that you're going to have your ups and downs, and to understand that when a down comes, there will be another up. And the most important thing probably of all is persistence. You've got to keep on going. But ultimately, when you actually have a success in a project or more than one project, and you know that you're improving care for patients, that's hugely motivating, because that's why we're all here.